Professor SNAB, where we aim to make A-level biology as simple as a cell. So today we're looking at understanding the contributory causes of hospital-acquired infections, which have later led to codes of practice regarding antibiotic prescription and hospital practice that relate to infection prevention and control. So, what are hospital-acquired infections? As given by the name, these are infections that develop during or after a hospital stay and were not present at the time of admission. And a very common example is the MRSA. So, the causes of hospital-acquired infections are the overuse and misuse of antibiotics. So, excessive or inappropriate use of antibiotics creates a selection pressure. And this leads to the survival and reproduction of the resistant bacteria, which leads to the spread of antibiotic-resistant strains such as MRSA. Then you also have immunocompromised patients, where many hospital patients have weakened immune systems due to illness, surgery, chemotherapy, or age. And these patients are more susceptible to infection, allowing pathogens to spread more easily. So the high population density and close contact in hospitals are also another contributory cause. So hospitals contain many patients in close proximity, which increases the chance of cross-infection through vectors such as direct contact, shared equipment, and healthcare workers. And then you have the invasive medical procedures, such as the use of catheters, ventilators, and surgical wounds, go past the natural barriers such as the skin, providing direct entry routes for pathogens. So what are the codes of practice for antibiotic prescription? So antibiotics are only prescribed when necessary and not for viral infections. And if possible, the use of narrow-spectrum antibiotics is encouraged. So antibiotics are prescribed at the correct dosage for the correct duration, and review and discontinue of the use of antibiotics when no longer needed is encouraged. And these steps slow down the evolution and spread of resistant bacteria. So what are the codes of practice that are now being implemented in hospitals? So the first one's hand hygiene, where mandatory hand washing or alcohol gel use before and after patient contact to remove pathogens and reduce cross-infection. The use of PPE, which is gloves, gowns, and masks, to be used to reduce transmission between patients and staff. Sterilization and cleaning, where all surgical instruments and equipment should be sterilized and ensure regular cleaning of wards and surfaces to reduce pathogen survival. And finally, you have patient isolation, where patients with known infections are isolated to prevent infection spreading to vulnerable patients. So that is all for Professor SNAB today. I hope you found this video useful. If you have any questions, please let me know in the comments below and I'll get back to them as soon as possible. And don't forget to like, share, and subscribe.